In epidemiological research published in 2019, updated calculations have since demonstrated an even larger increase in dental fluorosis than previously reported. The authors wrote, quote, "For ages 12 to 15 years, an age range displaying fluorosis most clearly, total prevalence increased from 22% to 41% to 65% in the 1986-87, 1999-2004, and 2011-2012 surveys, respectively. The rate of combined moderate and severe degrees increased the most, from 1.2% to 3.7% to 30.4%. The community fluorosis index increased from 0.44 to 0.67 to 1.47, end quote. This information is particularly concerning because dental fluorosis is considered the first visible sign of fluoride toxicity. Dental fluorosis was the first and most obvious toxic reaction we knew about from trace levels of fluoride in water. And if fluoride can cause metabolic derangement of dental enamel, which is among the most visible tissues in a person's body, we can easily imagine the damage to other less visible processes. It turns out that there is a lot of evidence of harm from fluoride exposure at levels similar to what is recommended for community water fluoridation. In 2002, the U.S. National Research Council was contracted by the Environmental Protection Agency to reevaluate its safety standard for fluoride that occurs naturally in drinking water sources. The level had been set at 4 parts per million. The NRC panel of 12 scientists published their massive report in 2006. They concluded that the 4 parts per million standard was not low enough to protect the general public from health hazards, including severe dental fluorosis and bone fractures over a lifetime of drinking that water. The 2006 report from the National Research Council concluded that the EPA's MCLG, that's the maximum contaminant level goal for fluoride, should be lowered. In addition to recognizing the association between fluoride exposure and osteosarcoma, a bone cancer, the 2006 National Research Council report cited concerns about musculoskeletal effects, reproductive and developmental effects, neurotoxicity and neurobehavioral effects, genotoxicity and carcinogenicity, and effects on other organ systems. The source is the National Research Council, Fluoride in Drinking Water, a Scientific Review of EPA Standards, National Academies Press, Washington, D.C., 2006. A notable quote from the National Research Council's report is the following, quote, "Overall, there was consensus among the committee that there is scientific evidence that under certain conditions, fluoride can weaken bone and increase the risk of fractures. The majority of the committee concluded that lifetime exposure to fluoride at drinking water concentrations of 4 milligrams per liter or higher is likely to increase fracture rates in the population, compared with exposure to 1 milligram per liter, particularly in some demographic subgroups that are prone to accumulate fluoride into their bones, like people with renal disease," end quote. In support of the concerns raised by the National Research Council in 2006, scientific research has continued to link fluoride exposure with a wide range of health risks. Exposure to fluoride is suspected of impacting nearly every part of the human body, including the cardiovascular, central nervous, digestive, endocrine, immune, integumentary, renal, respiratory, and skeletal systems. Susceptible subpopulations, such as infants, children, and individuals with diabetes or renal problems, are known to be more severely impacted by intake of fluoride. Accurate fluoride exposure levels to consumers are unavailable. However, estimated exposure levels suggest that millions of people are at risk of experiencing the harmful effects of fluoride and even toxicity, the first visible sign of which is dental fluorosis. For citations to support all of the health conditions listed on the graphic, access the IAOMT's position paper against fluoride use. Also, in the next video, IAOMT dentist Dr. Tammy D. Gregorio and Dr. David Kennedy discussed some of the health risks linked to water fluoridation.